So again, one more new topic that is much more important. Day to day life, we also use the medication that is the anticoagulants. So first we discuss the direct thrombin inhibitor. Direct thrombin inhibitor. Direct thrombin inhibitor, that is the apixaban rivaroxaban. That is the apixaban rivaroxaban. Clear? The first anticoagulant is the direct thrombin inhibitor. Direct thrombin inhibitor. First one is the apixaban, is the DTI. Then rivaroxaban is also another DTI. We also use in the IV or SC. Route is IV or SC. We also use the medication in IV, intravenous or subcutaneous. Then the ITI, indirect thrombin inhibitor. Clear? Indirect thrombin inhibitor. Clear? Second one anticoagulant is the indirect thrombin inhibitors. The indirect thrombin inhibitor, that is the in the indirect thrombin inhibitor, under the indirect thrombin inhibitor there are two medication are settled. First one is the UFH. UFH on fraction heparin. The infraction heparin, that is LNWH. It is low molecular weight heparin. Under indirect thrombin inhibitor ITI, that is UFH, that is the unfractioned heparin, and LNWH, that is the low molecular weight heparin. Then we distinguish between the UFH and LMWH. UFH and LMWH. UFH means the unfractioned heparin, LMWH low molecular weight heparin. In LMH there is UFH is the first one is the prophylaxis. The UFH unfractioned heparin used as the prophylaxis. So the treatment of UF, in the UF, which case the UFH is used. The UFH is used to catheter induced thrombosis. Induced thrombosis. Prophylaxis. The, the UFH is used as a prophylaxis, and it is used in the catheter-induced thrombosis, and second one is the dialysis. The UFH also used in the dialysis. So LMWH is used. It also the prophylaxis. Prophylaxis. It is used in subcutaneous. The LMWH also used in the prophylaxis in subcutaneous route. The dose is OD. The LMWH used on once a day. We always use the low molecular weight heparin once daily. So it is used, first one, uses thrombosis, MI. Clear? The LMWH is used in case of thrombosis, in case of the myocardial infarction and the unstable angina. The unstable angina, the LMWH is also used in the pulmonary embolism. The pulmonary embolism, then they also used. Yeah, it is the basic difference. Yeah, the LMWH is used in the thrombosis, MI, unstable angina, and the pulmonary embolism. Yeah, it is also used as a prophylaxis, and the route of LMWH is the subcutaneous. The LMWH is also used the once daily. The dose is once daily. Then we move to the side effect of heparin. Which kind of side effect we will see in the heparin? Side effect of heparin. So first, clear? The side effect is a heparin. Hyperkalemia, hyperkalemia means the increased potassium level. Potassium level. Then second one is the hair loss. It's called the alopecia. Hair loss is called the alopecia. Then osteoporosis. Osteoporosis is due to the decrease in the bone BMD, bone mass density. Yeah, that is the leading side effect of heparin. Then fourth one is the thrombocytopenia. Fourth one is the thrombocytopenia, means the decrease platelet count. Yeah, decrease platelet count. So the side effect of heparin. First one is hyperkalemia, increased potassium level. Second one is hair loss, that is alopecia. Third one is the osteoporosis. Fourth one is the thrombocytopenia. Then the coumarins, also called the warfarins. Coumarin means the warfarin. Then the coumarin or the warfarin. That is the teratogenic. Contraindicated in pregnancy. Okay? In coumarin group there is in the warfarin. Always remember the warfarin crosses the placenta, so that it is teratogenic. So it is contraindicated in pregnancy because the warfarin crosses the placenta and it causes the congenital malformation. So in pregnancy the warfarin is contraindicated. So it is all about the anticoagulants. Okay? So next class we will discuss about a new topic. So thank you.